Hello, I'm Zeynep Sudeşakır. Today I will be discussing bruxism, commonly known as teeth grinding or clenching. Together we will explore its causes, symptoms and treatment options. What is teeth grinding? Teeth grinding or bruxism is a condition where the jaw muscles contract involuntarily, causing the teeth to grind or clench. While it often occurs during sleep, it can also happen unconsciously during stressful moments throughout the day. There are several reasons why someone might develop bruxism. The most common causes include stress and anxiety, sleep disorders, jaw or teeth alignment, jaw or teeth misalignment, genetic predisposition, neuromuscular disorders. Symptoms of teeth grinding. Common symptoms of bruxism include waking up with jaw pain or tightness, worn, clenched or sensitive teeth, freaking headaches especially around temples, pain or clicking sounds in the jaw joint, difficult opening your mouth fully. If you notice any of these symptoms, it's essential to seek professional advice. At Klinik M, we offer modern and effective solutions to treat bruxism. Common treatment options include night guards, jaw botox injections, orthodontic treatment. Can teeth grinding be prevented? While it's not always possible to completely prevent the teeth grinding, certain steps can help reduce the risk. Manage daily stress levels. Improve sleep quality. Visit your dentist regularly. Avoid hard or chewy foods that strain your jaw. Teeth grinding affects not only your dental health but also your overall well-being. Fortunately, modern dentistry offers effective ways to manage and treat this condition. At Klinik M, we are here to provide personalized solutions to help you achieve a healthy jaw and restful sleep. For more information or to book an appointment, feel free to contact us.